So, people trapped in food desert communities have low access to fresh produce, limited transportation, and are often surrounded by an overabundance of fast food establishments, resulting in diets high in fat, sugar, and calories. This is a big problem because these factors contribute to higher rates of obesity, diabetes, and heart disease among children and adults. The methods I want to include for this research is a windshield survey, site observations, literature reviews, 13 theory-based key informant interviews, and a focus group. The purpose of my research is to understand the barriers people face when consuming unhealthy foods, as well as, in the future, create programs and interventions to alleviate these barriers and create awareness of healthy versus unhealthy foods for students at a local elementary school as a preventative measure. So, to understand the scope of the problem worldwide, the world prevalence of diabetes among adults 20 to 79 years of age was about 285 million cases in 2010. In the United States alone, in 1958, 1.58 million people were diagnosed with diabetes. In 1980, it increased to 5.6 million people. In 2000, it nearly doubled to 12 million people, and by 2035, it is estimated that 50.4 million people will be diagnosed with diabetes. This has cost the United States an annual total of $174 million in medical expenses in 2007 alone. So I decided to concentrate my research in Muscoy, California, and further concentrated in Muscoy Elementary School because I do want to target children and the younger generation as a means of a preventative measure. So in 2014, 99.2% of Muscoy Elementary students were considered socially economic disadvantaged. And in 2010, 82.9% of Muscoy residents were Hispanic or Latino. In 2009 to 2013, at least one-third of Muscoy residents were living below the federal poverty line. According to the Community Foundation, San Bernardino City and Fontana school districts had the highest proportion of students with unhealthy body composition. 53% of these children were overweight or obese. This is very alarming, which is why I really wanted to concentrate in students and in children. So in my literature review, the food desert were described by the United States Department of Agriculture as urban neighborhoods in rural towns without ready access to fresh, healthy, or affordable food. Barriers to eating healthy include living in low-income neighborhoods, which tend to be built with less supermarkets and more convenience stores and fast food restaurants. In addition, researchers have noted that cost, distance, and transportation could also serve as a barrier. An alternative to purchasing foods from convenience stores and fast food restaurants in these neighborhoods would be growing one's own produce through gardening, like a community farmers market, for example. So my research question for this is, what barriers do people face when eating healthy foods? So the eligibility for my research are participants must have a connection to the Muscoy community, must be a student of Muscoy Elementary School, or must be employed by Muscoy Elementary School, or it must be a parent of a student in Muscoy Elementary School. I will conduct a windshield survey in Muscoy, San Bernardino County, and also at the site, Muscoy Elementary School. I will perform key informant interviews, 3 of them being with school staff members, 4 with parents, and 6 with students. And I will also perform a focus group with 7 participants and 2 participants living in Muscoy. And using grounded theory, the data will be transcribed, analyzed, and coded for themes. The strengths for my research are the interviews will allow for causes of the problem, possible solutions, and anticipated issues to be uncovered. The windshield survey would serve as a great observational method because it would allow me to see the approximation they have to parks, how safe it is to walk in their neighborhoods. For example, if they have sidewalks, if they walk to school, if they have a lot of police activity around their neighborhood, if they have bus stops close to your school, and as well as other things. And these themes can also be accessed with the interviews that I will conduct that will help understand barriers that this community faces. Interventions can then be formed through these findings. Limitations. Participants were concentrated in just one geographical area, and the sample size was very small. And it was also very time consuming. I do understand that health behaviors and social support also affect health, so including these limitations in future research can make for a better study. The implications. After discovering the barriers to eating healthy, health professionals are better able to design a gardening or health curriculum project for students in Musco Elementary School for preventative measures. This can work as an educational opportunity for students to know the consequences of a poor diet and to distinguish between healthy and unhealthy foods. It can also assist other communities living in food deserts. Utilizing the family values of this community, gardening projects can actively engage these students while inviting parents and siblings to participate as well. Future studies can focus on how farmers markets can remove barriers like cost and distance so that families can have access to fresh fruits and vegetables. So these are my references. Thank you so much for watching.